Good morning to you and welcome back here to New Day Cleveland. I am here at Beachwood Plastic Surgery, of course, right in Beachwood on Chagrin Boulevard. And what we're going to be doing this morning is talking about the fact that you do not always have to go under the knife to look and feel better about yourself. And I have Dr. Stephen Goldman here joining me. It's good to see you.
Good to see you too.
So this space that you have is a brand new office, first of all, absolutely beautiful here.
Thank you.
And I would say there's basically three main prongs to what you do.
So surgeries, of course, the biggie, right? But especially in the area of Botox and fillers, non-surgical, injections, technologies like cool sculpting, and then we have a spa side. So I think those are the three main components of plastic surgery now: surgical, non-surgical, spa. So we want to be able to offer everything.
So, and I think there's a lot of people that might be watching now who have done some of these procedures, and then maybe some who are interested and nervous to try it. So I think being here really allows people to see what this is all about. We have a couple procedures going on right now. The first one's really neat. This is the cool sculpting room.
Okay.
You can probably do this in a lot of different rooms, but we have one right here.
So this is Terry. She's been kind enough to participate in our segment. So Terry's getting cool sculpting as we speak. Cool sculpting is pretty well known at this point, but it's a non-surgical technology where basically a very high-tech refrigeration unit is connected to a handpiece, which then is connected to an area of the body like the belly or the love handle, and by almost freezing that area of the body, you traumatize the fat, and in most people, the fat will then shrink afterwards. So it's not as powerful as liposuction, but it's kind of nice to read a book and have something that reduces the fat.
Terry's so relaxed. She looks great just sitting there. Now, someone getting this done, they could go back into work if they needed to, or what's the downtime with something like this?
So it will often feel like a bruise. So I think a lot of patients, thank you, Terry.
And Jody, thank you both.
And Jody. So a lot of patients will take the rest of the day off, but you don't have to. So it's not so much a lunch break kind of thing, but it really is a no downtime kind of thing. So people can work out the next day, go to work the next day. So it's very convenient, which is why people are doing cool sculpting and other similar non-surgical procedures a lot.
Now, this is another one that you can go right back into work after this, right?
Yeah,
if you'd
so
like to.
These are injections. Our nurse injector, Jody. We have two nurse injectors. Jody is injecting.
Now, it's hard for me to needles. I always have to close my eyes anytime I get a shot, but I know that being the patient probably isn't as traumatic as it is watching a needle go in.
So Botox and now the fillers, and we literally have almost a dozen fillers available, all of which are slightly different, some of which do one thing better than another, but all of these non-surgical injectable procedures really have the ability to, in a natural way, as long as they're done right, rejuvenate, make the face look younger. And that is something where many people will do this over lunch break, or many people will do it at the end of the day and then go to work the next day. Thank you, Denise.
Like Janine right there. Thank you, Jody, too. Now,
thanks, Jody.
Now that's the thing with your work and the people that you have working for you that I have noticed, because we've had you on the show several times, and I think there's a difference between what people see and what they envision work to be like and what you do, because you try to make people look as natural as possible.
So if it's obvious that somebody's had injections or surgery, then that's not an aesthetic result, right? On the other hand, if you don't see any change, who would want that? So you have to have a dramatic change that looks natural, and surgical procedures do different things than non-surgical procedures. And in fact, say treating the crow's feet, Dysport or Botox do that better than surgery. But taking a hump off the nose, even though we have non-surgical options for rhinoplasty, surgery does that better than injectables. So you have to, one, know what tool is right for what indication, and two, know what's right for that specific person, right? So that's why all these things are fun, and that's why you want a complete array of options, surgical, non-surgical, even spa, because they all complement each other, right? And that's obviously my philosophy, but I like it a lot.
Well, and he's not only a great doctor, but a great person. I know you have a second location that's out in Westlake where you do a lot of these similar procedures. I know the surgery is mainly here.
No surgery in Westlake, but everything else in Westlake.
So, but we're going to show you the different assets of this great location here in Beachwood. We're going to be back a couple more segments here, and I really think we're taking any haste or nervousness people might have about plastic surgery or things like this out of the question today.
Education.
Education.
Learn about it first. Feel comfortable with the facility, the people, the doctors, but education is key.
All right, David, I'm sending it back to you, and no, I am not getting a facelift right now.
Maybe he
wants one. I'm so glad to hear that.